Assalamu alaikum. This is Dr.
Diwali
Hasib.
song.
Can you hear me?
Yes, sir.
Okay. Should we start?
Yes, sir.
Okay. Thank you.
Welcome.
Assalamu alaikum, students. Hope you are fine. Today we are going to discuss yet another very important topic, that is sleep and sleep disorders. Sleep physiology rather is a separate subject, and most of the research is going on in this topic. So by the end of today's session, you will be able to define sleep, what is the mechanism behind sleep, why do we sleep, then what are the physiological changes that occur during sleep, what is the importance of sleep. Then we will learn the different stages of sleep, REM sleep and non-REM sleep. We will learn the differences between the two types. And at the end of the lecture, we will discuss few of these sleep disorders. So these are the learning objectives for today's session. So let's begin. So what is sleep? So it's very difficult to define sleep. Uh, Sleep is not merely closing your eyes and counting sheep. Rather, it's a very intricate procedure, very complicated procedure. So one way of defining sleep is unconsciousness from which a person can be aroused. So the thing to note is the state of unconsciousness from which one can be aroused by either sensory stimuli or any other stimuli. So this is the difference between sleep and coma. So another way to define sleep is a reversible state of disengagement from the environment. Reversible state of disengagement from the environment. So sleep, it's a complex state in which physiological as well as behavioral processes are compared with wakefulness. So one thing is for sure, that sleep is physiological. It's a physiological phenomenon. Moreover, it is reversible. So sleep is episodic, number one. It is reversible, number two. It is a state of unconsciousness, or you can say reduced awareness. Not only reduced awareness, but also reduced responsiveness to any stimulus. So these are the characteristics of sleep, a physiological phenomenon in which a person gets disengaged from the environment. So it's an unconscious state from which a person can be aroused. So what are the mechanisms behind sleep? Why do we sleep? And there are different theories behind the phenomenon of sleep. And according to one theory, the reticular activating system, commonly known as RAS or RAS, this system is responsible for the normal sleep wake cycles. So when the reticular activating system, which is located within the brainstem, when it becomes fatigued during the daytime, the body goes to sleep. So this is one of the theories. So remember, sleep is caused by an inhibitory process, an active inhibitory process. And the center of sleep is located at the mid-pontile level of the brain. the brainstem. Now, what are the role of different neurohormonal substances and neurotransmitters in sleep? What are the different neurotransmitters that promote sleep or cause sleep? One of the neurotransmitters is serotonin. Now, this is the substance which promotes sleep. And from where this neurohormonal substance released? This is released from the Raphe nucleus. This Raphe nucleus is located within the brainstem, especially the lower part of pons and the medulla oblongata. And these Raphe nuclei are responsible for the release of this neurohumoral substance, serotonin. Another nucleus which is located within the brainstem is nucleus of Trakt. Heard this term, commonly denoted by NTS in capitals, nucleus of Tractus solitarius. Now again this is located within the brainstem at the termination of medulla oblongata and pons. So this nucleus is also known to cause sleep besides the Raphe nucleus. So besides the brainstem nuclei, Raphe nuclei and nucleus of Tractus solitarius, there are other areas located within the diencephalon. For example, the rostrum of the hypothalamus, which includes mainly the suprachiasmatic area. This is also known to cause sleep. So the important nuclei responsible for promoting sleep include Raphe nucleus, nucleus of Tractus solitarius, both located within the brainstem. Raphe nuclei, they are responsible for the release of serotonin. Then we have suprachiasmatic nucleus, part of the diencephalon. All these nuclei, they are responsible for causing sleep. So whenever there is damage to these sleep promoting areas, this will obviously lead to intense wakefulness, and such a person will not be able to go to sleep. So lesions in these sleep promoting areas will lead to wakefulness. For example, we just have discussed about the Raphe nucleus located within the brainstem. So if there is lesion within these nuclei, obviously this will cause intense wakefulness. Similarly, lesion within the suprachiasmatic nucleus will lead to wakefulness again. So in either case, the excitatory reticular nuclei of midbrain and pons, they become released from inhibition. Now the thing to note is that they become released from inhibition. So no more inhibition will be there. So loss of inhibition will result in wakefulness. Now we will discuss the sleep wakefulness cycle. So what happens during sleep? So when the sleep centers are not activated, the midbrain and upper pontile reticular activating nuclei, they will release from the inhibition as we have just discussed. So loss of inhibition will result in overexcitation. So this will send positive feedback signals to the reticular activating system. So once wakefulness begins, it has a natural tendency to sustain itself all by itself. And this is one of the examples of positive feedback mechanism in which the reticular activating nuclei become active. And when the brain is active for many hours, so a stage comes when these neurons they become fatigued. So this will cause positive feedback cycle between the midbrain reticular nuclei and the cerebrocortex. So thus this positive feedback cycle due to fatigue of neurons will eventually fade away. Hence, the sleep promoting areas will dominate, will take over, and the person will go back to sleep. So, this is the cycle between sleep and wakefulness. So, during wakefulness, when the sleep centers are not activated, the reticular activating nuclei they take over, and the person goes to wakefulness. And if the person remains active for many hours, this will cause fatigue of the neurons and the positive feedback cycle will fade away, and this will be followed by the domination of sleep promoting areas. So we have discussed neurohumoral substances which are important in wakefulness. One of them is orexin. So orexin is one of the neurohumoral substances which is released from the neurons within the brainstem, and this orexin, also known as hypocretin, is released from the hypothalamus, and these are responsible for wakefulness. And these neurons, orexin neurons, they remain active when you are awake, and during sleep they almost shut down. So release of orexin from the orexin neurons is dependent on sleep wakefulness cycle. So the orexin neurons are active when you are awake and they are dormant when you are asleep. And loss of this orexin or hypocretin will result in excessive daytime sleeping. And we call this condition as narcolepsy. So narcolepsy is excessive daytime sleeping, and the most common hypothesis for narcolepsy is loss of hypocretin, one of the neurons which is very important for wakefulness. We will discuss the details of narcolepsy in the coming slides. Now here you can see the role of melatonin in the sleep wakefulness cycle. So what is melatonin? Melatonin again is a substance released from one of the endocrine organs, and the endocrine organ responsible for the release of melatonin is the pineal gland. This pineal gland is one of the endocrine organs, and this will release the neurohumoral substance melatonin. And melatonin has a very important role in our circadian rhythm. So how release of melatonin takes place? It starts from the stimulus, and stimulus in this case is light. So light rays, whenever they enter the retina, this will stimulate the hypothalamus. So hypothalamus will transmit the signal through the sympathetic division to the pineal gland. So this signal from the hypothalamus will be sent via the sympathetic fibers, and the signal will be sent to the pineal gland. Here you can see the location of pineal gland. So whenever there is decrease in light or whenever there is darkness, this results in in increased sympathetic stimulation. And greater the sympathetic stimulation of pineal gland, greater will be the release of melatonin, and vice versa. For example, whenever there is increase in light or excessive light rays are thrown, this will result in decreased sympathetic stimulation to the pineal gland, and obviously the melatonin secretion will be compromised as well. So increased secretion or decreased secretion of melatonin, this depends on the amount of light entering the eyes or the amount of light entering the retina. If the amount of light is less, this will cause increased melatonin secretion. If the amount of light is greater, this will result in decreased melatonin secretion. And one of the functions of this neurohumoral substance, melatonin, released from the pineal gland, is its role in inhibition of the gonadotropic releasing hormone. And these GnRH, which are released from the hypothalamus, their secretion will be inhibited by the melatonin. And this will help to regulate the sleep cycle. So we have discussed melatonin is the neurohumoral substance released from the endocrine organ pineal gland, and release of melatonin is dependent on the amount of light entering the retina. Now these are the steps of synthesis and release of melatonin from the pineal gland into the bloodstream. And here you can see this melatonin is serotonin. Serotonin is converted into N-acetylserotonin first, and then this N-acetylserotonin is later on converted by another enzyme, hydroxyindole methyltransferase. And this hydroxyindole methyltransferase will convert acetylserotonin into melatonin. And the melatonin will be released from the pineal gland into the bloodstream. Another important thing to notice in the figure is that the synthesis and secretion of melatonin, they are increased during the dark period, as you can see in the shaded region here. This shaded area indicates the dark period. So melatonin secretion is increased during dark period, whereas whenever there is high concentration of light rays, the melatonin secretion will be inhibited. Again, this figure is taken from Ganong's review of medical physiology. This depicts the same mechanism that we have just discussed. Light rays will enter the retina, and this signal from the retina will enter to the suprachiasmatic nucleus of the hypothalamus. And the pathway responsible for relaying the signal from the retina to the suprachiasmatic nucleus of hypothalamus is known as the retinohypothalamic fibers. These retinohypothalamic fibers, as the name indicates, from the retina to the hypothalamus. Retinohypothalamic fibers. These retinohypothalamic fibers will transmit the signal from the retina to the hypothalamus. Then this retinohypothalamic fibers will activate the suprachiasmatic area of the hypothalamus, and this will inhibit the paraventricular nucleus. Inhibition of paraventricular nucleus will result in activation or excitation of the intermediolateral nucleus. Here you can see. And once activated, this intermediolateral nucleus will activate the superior cervical ganglion. As we have discussed, superior cervical ganglion will send the sympathetic fibers. These are the sympathetic preganglionic fibers, and they will innervate the pineal gland. So stimulation of pineal gland will cause release of melatonin. So this is the mechanism behind release of melatonin. In this figure, you can locate the important structures located within the brain that are related to sleep wakefulness cycle. For example, one of the important structures is the hypothalamus. And within the hypothalamus are multiple nuclei which are related to sleep. For example, suprachiasmatic nucleus, nucleus of tractus solitarius, another important nucleus, nucleus of locus ceruleus, very important nucleus, and the Raphe nucleus. So I have highlighted the important nuclei which are related to sleep wakefulness cycle. So I repeat, the hypothalamic areas of suprachiasmatic region, the nucleus of tractus solitarius, nucleus of locus ceruleus, and Raphe nucleus. All these are very important for the sleep wakefulness cycle. And besides hypothalamus, there is another endocrine gland that we should not forget, that is pineal gland. So please do not forget the role of pineal gland in sleep wakefulness cycle. So not only hypothalamus but pineal gland is also important, which is responsible for the release of melatonin. Again, you can see the important structures which are related to sleep wakefulness cycle, and the collective terminology that we use for all these structures, for all these nuclei, is reticular activating system or simply reticular formation. Remember, reticular formation or reticular activating system is the collective term for all the structures related to sleep. And these structures are mostly located within the brainstem, the medulla oblongata, as well as the pons. So this is the brainstem region plus the fourth ventricle region and the cerebral aqueduct area. They are also involved. So these are known as the reticular formation. So besides the role of reticular formation in wakefulness or arousal, there are other functions of reticular activating system as well. For example, this system is responsible for regulation of heart rate, regulation of arterial pressure, regulation of blood flow, and regulation of circulation. Yeah, no. All right. Sorry for the interruption. Somebody unmuted me. So where were we? We were discussing the reticular activating system. So reticular activating system includes all the structures that are related to either sleep or wakefulness. So it's a collective term. The other name for reticular activating system is reticular formation. And this system includes the structures which are present within the brainstem, the structures present within the medulla, midbrain, pons. Moreover, the structures within the fourth ventricle and the cerebral aqueduct are also included. Besides the primary role of reticular formation in wakefulness or arousal, there are other functions of this reticular activating system like regulation of heart rate, regulation of arterial pressure, and regulation of respiration. Now, this figure is very important for your concept building. Here you can see how alternate activity of brainstem and hypothalamic neurons different influence the consciousness. For example, whenever there is increase in the level of the neurotransmitters norepinephrine and serotonin, this will cause suppressed levels of the excitatory neurotransmitter acetylcholine. So, suppressed levels of acetylcholine and increased levels of norepinephrine and this will promote wakefulness. This will promote wakefulness and vice versa. For example, whenever there is fall in the levels of norepinephrine and serotonin, in the absence of this, the acetylcholine levels will increase and this will promote sleep, usually REM sleep. We will discuss what is REM sleep and non-REM sleep in the coming slides. So norepinephrine and serotonin, increased levels of norepinephrine and serotonin, they are responsible for wakefulness. Suppressed levels of norepinephrine and serotonin, they are responsible for REM sleep. And whenever there is an equilibrium between all these neurotransmitters, an equilibrium is achieved, this will cause non-REM sleep. So during non-REM sleep, an equilibrium is achieved between all these neurotransmitters. So what happens during wakefulness? This will activate the thalamus as well as the cerebral cortex and histamine will be released. Greater the amount of histamine release, lesser will be the amount of gamma amino butyric acid. And the opposite is true for non-REM sleep. So during non-REM sleep, the activation of the thalamus as well as the cerebral cortex is suppressed. This will cause decreased release of histamine. In the absence of histamine, gamma amino butyric acid will take over and hence the circadian rhythm is maintained. So this is the role of the reticular activating system in maintaining the circadian rhythm. The thing to remember is that norepinephrine and serotonin are the neurotransmitters required for wakefulness. Whenever there is increased concentration of these neurotransmitters, they will suppress the acetylcholine, hence will promote wakefulness. And the opposite is true for REM sleep, in which the levels of norepinephrine and serotonin drop and the levels of acetylcholine increases. And these are the minimum sleep hours, or you can say the sleep requirement for different age groups. Here you can see the duration is much greater in infants and children as compared to adults. So 6 to 8 hours is the normal requirement for sleep. So you can reduce 6 to 8 hours to 2 to 3 hours for the MBBS students. Now, what are the physiological changes that occur during sleep? So, sleep is a phenomenon in which all the systems are affected: the circulatory system, the cardiovascular system, the GIT system, the central nervous system, the renal system. So, basically, all the systems of our body, they are affected during this phenomenon. So, what are the circulatory changes during sleep? And the important thing to note is that during sleep, the pulse rate, the cardiac output, the arterial pressure, all these parameters are reduced. Moreover, there are respiratory changes. For example, change in the tidal volume. So during sleep, the tidal volume and the respiratory rate, they may be lowered. Similarly, the BMR, or what we call basal metabolic rate, may be reduced to 5 to 10%. So during sleep, the urinary output is also reduced. Not only the urine volume is less, but the salivary and lacrimal secretions are also reduced to some degree. So the thing to note is, although the salivary and lacrimal secretions are reduced, but the secretion from the sweat glands during sleep is increased. Then comes the muscle tone. So during sleep, the muscles, they become relaxed or hypotonic state. So the tone is decreased during sleep. Although the muscle tone is decreased in most of the skeletal muscles, but if you consider the muscles of the eyeball or the extraocular muscles, they become active. So there is movement of the eyeballs, and the eyeballs, they start to roll up, especially during REM sleep, rapid eye movement sleep. Then there is plasma dilution. This will result in increased volume of blood during sleep. The deep tendon reflexes, the stretch reflexes, they are reduced during sleep. The Babinski sign is extensor during sleep. And then there are EEG changes that we will discuss tomorrow, inshallah. Electroencephalographic changes. So these are the physiological changes that may occur in an individual during sleep. And this is the summary. Here you can see sleep is a phenomenon which affects almost all the systems of the body. The GIT system, you have seen decrease or suppressed function of the GIT during sleep. So GIT system is affected. The renal system is affected, as indicated by this decreased urinary output. Then the circulatory system or cardiovascular system is affected. The heart rate, arterial pressure, cardiac output, there is change in these parameters. Moreover, the respiratory system is affected. The respiratory rate, the tidal volume, they may vary between the two extremes. And then the endocrine system, different endocrine hormones like growth hormone, prolactin, their secretion are increased during sleep. That is why sleep is very important for our normal body functions, because of its role in homeostasis. So what is the physiological role of sleep? What are the physiological functions of sleep, or what you can call is the importance of sleep. Why do we sleep? So first and foremost is the maintenance of the metabolic caloric balance. So sleep maintains this metabolic caloric balance and hence conserves our metabolic energy. Moreover, this is responsible for maintenance of thermal equilibrium. So maintenance of body temperature is yet another important function of sleep. And this develops our immune competence as well. So sleep has its role in development of immune competence. And recent research indicates that sleep also promotes learning or memory consolidation. So facilitation of learning or conversion of short-term memory to long-term memory that we call consolidation phenomenon, all these are the functions of sleep. So neural maturation takes place during sleep. The role of sleep in cognition or thinking ability is also there. Then during sleep, most of the metabolic waste products they are cleared off the body. So in one line, we can say sleep is important for restoring both the normal levels of brain activity and the normal balance among the neuronal centers. And we call this balance as homeostasis. So this is why sleep is physiologically very important for us. So far we have discussed the definition of sleep, the characteristic features of sleep. We have discussed the role of reticular activating system, the role of pineal gland, and the neurohumoral substance released from the pineal gland, melatonin, in the sleep wakefulness cycle. Now we will discuss the stages of sleep. So the two major types of sleep are non-REM sleep, number one, and REM sleep, number two. So these are the two primary types of sleep, where non-REM stands for non-rapid eye movement sleep and REM stands for rapid eye movement sleep. Remember, rapid eye movement sleep is also known as desynchronized sleep. Why we call it as desynchronized sleep? Because the brain waves they are in a desynchronized fashion. We will learn the different types of brain waves, the EEG waves tomorrow inshallah. Another name for REM sleep is paradoxical sleep. Again, why do we call it as paradoxical sleep? Again, because of the brain waves or the EEG waves. So the electroencephalogram during REM sleep is almost similar to a person who is awake. So although the person is in sleep mode, but the EEG depicts otherwise. That is the reason we can call it as paradoxical sleep. Now the other type of sleep, non-rapid eye movement sleep, is further subdivided into four stages. Stage 1 and 2, which are known as light sleep. The first two stages of non-REM sleep are light sleep, and then stage 3 and 4. So the last two stages, 3 and 4, they are known as deep sleep. So light sleep, first two stages, and deep sleep, the last two stages. In contrast to REM sleep, the brain waves of non-REM sleep or the electroencephalogram is much synchronized. pattern. That is why non-REM sleep is also known as synchronized sleep. The electroencephalogram is in harmony, is in synchronized pattern. Other name for non-REM sleep, especially the stage 3 and stage 4 non-REM sleeps, are delta sleep or slow wave sleep. So these are the different terminologies that we frequently use whenever we try to describe the two types of sleep. So this is the classical staging of sleep. This is the classical staging. Now remember, this staging has been updated recently. So according to the updated classification, the non-REM sleep is divided into three stages: N1, N2, and N3. So we have omitted the fourth stage according to the new updated classification. But the classification given in your textbook is the classic one, and we will try to follow the classic definition, according to which the non-REM is divided into four stages. Stage 1 and 2 are the light sleep, and stage 3 and 4 are the deep sleep. So what are the differences between the two types of sleep? Slow wave sleep or paradoxical sleep, where paradoxical sleep is the REM sleep. Remember, these are the synonyms of each other: REM sleep, rapid eye movement sleep, or paradoxical sleep. All are same. So REM sleep is the paradoxical sleep, and non-REM sleep is the non-rapid eye movement sleep or slow wave sleep. So this is the comparison between the two major types of sleep, that is REM sleep and non-REM sleep. So the primary difference between the two types of sleep is obviously, as the name indicates, the movement of the eyeballs. So there is rapid movement of the eyeballs during the paradoxical sleep, and there is no movement of the eyeballs during the slow wave sleep or deep sleep. So this is the major difference between the two types of sleep. Now, if we look at the electroencephalogram, so non-REM sleep will depict slow wave pattern, whereas the REM sleep will depict an electroencephalogram, which is very similar to a patient or to a person who is awake. That is why we call it paradoxical sleep. So this is a paradox. Although the person is in sleep mode, but the EEG shows that the wave pattern is very similar to a person who is awake. Now, what are the other differences between the two types of sleep? The heart rate, the respiratory rate, and the arterial pressure. All these parameters, they are extremely irregular during the REM sleep. So they either increase in heart rate, respiratory rate, or arterial pressure, or decrease in these parameters may be observed. So these parameters, they tend to fluctuate during REM sleep. On the other hand, during non-REM sleep, most of these parameters like heart rate, respiratory rate, arterial pressure, or even tidal volume, there is no significant change. So no significant change is observed in these parameters in non-REM sleep, but these parameters are extremely fluctuating during REM sleep. Now, another important difference between the two types of sleep is the presence or absence of dreams. So dreaming is much more common during the REM sleep. So most of the dreams, they occur during the REM stage, and we rarely observe dreaming during the non-REM sleep. So although there is no dreams in the non-REM sleep, but this stage of the sleep comprises of almost 75 to 80% of the total sleep duration, whereas non-REM sleep comprises of almost 20 to 25% of the total sleep duration. Remember, REM sleep occurs in episodes. REM sleep occurs in intervals, after intervals of about 90 minutes each. So these are the important differences between the two types of sleep. Again, you can see the areas which are involved during REM sleep and non-REM sleep. During REM sleep, the prefrontal gyrus is involved. This prefrontal gyrus is inactive and the limbic system is involved. This is the active part. However, in non-REM sleep, the limbic system is inactive and the prefrontal gyrus or the prefrontal cortex is also inactive. So the limbic system or the limbic cortex is active most of the times in REM sleep. So this is the tabulated form of the same parameters that we have discussed that are observed in the two types of sleep, REM sleep and non-REM sleep. REM sleep is the rapid eye movement sleep. So we observe movement of eyeballs during this stage. Dreams are more common during REM sleep. Muscle twitching is another feature of REM sleep. All these features are usually absent in the non-REM sleep. Moreover, heart rate, arterial pressure, respiratory rate, tidal volume, body temperature, all these parameters are irregular during REM stage, whereas no more, no significant change is observed in these parameters during non-REM state. In this graph, you can observe the distribution of sleep stages in different age groups. In children, here you can see, in young adults and in elderly subjects. So the thing to remember is that the children have more total sleep duration as compared to adults. Similarly, adults have more total sleep time as compared to elderly subjects. Moreover, there is difference in the REM period as well among all these age groups. So the REM period is much greater in children as compared to young adults. Similarly, the REM period is much greater in adults as compared to elderly. This means as we age, there is variation in the sleep pattern. And these are the variables that either increase or decrease sleep with age. For example, with age, there is increase in sleep latency. There is increase in arousals or awakenings during sleep. There is increased tendency in napping. If we compare it with decreased age, all right. So with age, there is decrease in the rapid eye movement sleep, REM sleep. The sleep efficiency is also compromised. and there is decrease in the slow wave stage as we age. So these are the variations that we may observe with age. Here you can see alterations or variations in sleep with aging. So aging is associated with decrease in the amount of REM sleep. Then the sleep efficiency is also decreased. So with aging, the sleep is fragmented usually. Moreover, as we age, there is increased tendency to have naps, frequent naps, especially during the daytime. And as we age, there is increased likelihood to develop serious sleep disorders as well. So these are the variations that we may observe with aging. So since we have discussed all the physiological concepts of sleep physiology, now we will discuss the sleep disorders. We will not go into the details of each and every sleep disorder. Rather, we will point out the important disorders like insomnia, very common, narcolepsy, again a common sleep disorder, obstructive sleep apnea or obstructive sleep apnea syndrome, parosmia, restless leg syndrome. So these are the important sleep disorders, important for you people. So what is insomnia? In simple words, insomnia is inability to sleep, inability to remain asleep, inability to fall asleep. This is known as insomnia. And the opposite of insomnia is narcolepsy. Narcolepsy is excessive daytime sleeping. Narcolepsy is excessive, abnormal daytime sleeping. And if you remember, the hypothesis is that narcolepsy is due to loss of the neurohumoral substance orexin or hypocretin released from the hypothalamus. So whenever this hypocretin is deficient, this will result in excessive daytime sleeping, what we call as narcolepsy. So another important disorder is sleep apnea syndrome, obstructive sleep apnea syndrome. So what is obstructive sleep apnea syndrome? As the name indicates, it's an upper airway disorder in which the breathing is affected, especially during sleep, and the patients they complain of snoring and difficulty in breathing during sleep. So this is known as obstructive sleep apnea syndrome. Now another sleep disorder is parasomnias. Parasomnias. So parasomnia is a collective term which includes three disorders. Number one is sleepwalking. Number two is sleep talking. And number three is nightmares. So if all these three conditions are present in a single individual, we will label that person to be suffering from parasomnia. I repeat, sleepwalking, sleep talking, and nightmares. Remember, the other name of sleepwalking is somnambulism. So I prefer this term. The medical terminology for sleepwalking is somnambulism. So somnambulism plus sleep talking plus nightmares. This is the uh, condition known as parasomnia. Now another clinical condition is restless leg syndrome. Very common. You can see 5 to 6% of the population suffer from this restless leg syndrome. So what is restless leg syndrome? This is repetitive jerky movements, especially during sleep. And most of these movements are observed in the lower limb. That is why we call it as the restless leg syndrome. So during sleep, the patient keeps on moving his lower limbs in a jerky fashion. So we have discussed narcolepsy. Again, narcolepsy is excessive daytime sleeping, and this excessive daytime sleeping is due to loss of orexin or hypocretin. Hypocretin or orexin is the neurohumoral substance released from the hypothalamus, and loss of this orexin will usually result in narcolepsy, where narcolepsy is defined as excessive abnormal daytime sleeping. So this is all for today's session. Today we discussed what is sleep, why do we sleep, what are the types of sleep, and what are the important disorders related to sleep. Tomorrow, inshallah, we will discuss brain waves and electroencephalography. So thank you very much. Allah Hafiz.